Good afternoon, everybody. I hope you had a good weekend. That's Max from quarantine. We're getting by with a few people off the battlefield right now. But Josh and Paul are here remotely, as is Manisha Jutani, who I'll introduce to you in just one moment. First off, let's take a look at the COVID Daily Summary, because it's interesting. It's interesting in this sense. It's 3 days, so divide everything by 3 if you're used to keeping the box score here. We've now passed 3.5 million tests. That's almost 1 test per person here in Connecticut. You'll see that's a very high number compared to our peers. The positivity rate, 6.6%. So that number continues to creep up. You maybe remember just a little over a week ago, we were at less than 5% on average, on a 7-day rolling average. So keep watching that trend. Across America, the average is about 10.5%. Give you a little bit of perspective. I was checking our neighbors. We're a little bit more than Massachusetts. We're a little bit more than New York. We're a lot less than Rhode Island and New Hampshire and New Jersey. And Pennsylvania is at 35%. The good news is, I think, what was spiking in the upper Midwest just a few weeks ago looks like it's leveling off. So we're watching these numbers carefully, as are you. Next chart. All right, here's another eye test for you, but I thought it was interesting. This goes back from June till today. And the number one metric, of course, we all follow is hospitals, because hospital capacity is key as we figure out what we do going forward. I think you can see on this chart going back to June 1st, yellow are the admissions. Admissions is a key metric in terms of what's going on in the broader population. You can check infections, but that's sometimes tied to testing as well. Hospital admissions is key. So you can see back in June, we don't really have great numbers before that. We are a little less than 50. You can see of late our admissions are north of 150. That's on a weekly average. The light blue is the discharges. And that net number is the most important number that we look at as we try and figure out our capacity of our ICUs, capacity of our hospital beds, and stress upon our healthcare workers. And if you can really squint, you can see that light purple line, which is like the rolling hills of Litchfield County. And you can see that over the last month, it's gone up and down. You can see over the last week that net number of folks in the hospitals has been going down just a little bit. So let's watch that trend pretty carefully going forward. It's worth noting that half the people going into the hospital are over 70, but half the people are under 70 and as young as 20 and 30 and 40 years of age. Sometimes there's some other conditions, including weight, that can be contributing factors. So be careful, and whatever your age, you can still be infectious. So that's what's worth remembering. Let's go to the next one, Mulaney. We spent a lot of time on Thursday talking about vaccine. We're continuing to prepare for that. Deirdre and Reg gave you a good outline of our priority populations, focused on, A, keeping people safe, keeping our nurses and doctors able to keep going, and maintaining capacity. That's our primary role over the course of the next 6 weeks. And we think most of that population, almost all of that population, should have their double dose by the end of January. So we have got our orders in for the Pfizer vaccine, subject to the absolute final approvals, which are scheduled any day. You probably saw that Britain, they've already made all the approvals, and they start the vaccinations. I think it's as early as tomorrow. We'll be about a week, 10 days behind there. 16,000 doses going to the hospitals, 16,000 doses going to the long-term care partners about a week later, just to make sure they're ready to deliver the vaccine as needed. And we'll be making weekly orders going forward, tracking carefully our ability to administer the vaccine, demand for the vaccine, and the supply of the vaccine. And finally, tonight we're doing our executive order on providers who can administer this vaccine. to make sure that it's the pharmacies, big and small. It's Mighty Walgreens, it's CVS, also your small independent local pharmacies. It can be the federally qualified health centers and other locals. So we're going to be getting them up to speed, ready to go. So as we ramp up our capacity for vaccinations, we make sure that we can get those administered. The next one is just, I wanted you to see this because there's been longer lines at many of our testing facilities. We've got a lot of capacity. I think you can see that we're third most in the country, right behind Massachusetts there. Some of the other states, we're doing 3 times more than Alabama and Pennsylvania and some of the other states. So there's a lot of variability in terms of how much testing each of these states is doing. We're prioritizing it for underserved populations, doing everything we can to stay ahead of that curve. And finally, COVID has had a lot of impact on our communities, and it's not all reflected in the numbers. It's reflected in some of these headlines that I think are indicative of the incredible stress upon our communities, upon our families, and many of you. I was interested that dentists are reporting a great increase in broken teeth and chipped teeth and people gnashing of the jaw and what that indicates. The advocates are warning us about domestic violence ticking up quite a bit, addiction ticking up. I'm afraid gun owners are warning about a potential suicide and what that means. We've seen a lot of shootings in many of our urban centers and beyond. These are all signs of the stress that many of you are going through, which I think is worth remembering. There's some happier things. Home improvement is surging, and everybody who's at home are finding some constructive ways to use that time they have as well. Home sales are heating up, coming in from New York as people may be looking for a little more outdoors, a little more privacy, assuming that their days of quarantine are not necessarily over. My kids pointed out a headline about dating in the pandemic. It's like a Jane Austen novel, look but do not touch. So a lot of things are changing, and we're going to be careful for a little bit longer. I noticed this evening, Monday Night Football is not at 9 o'clock. It starts at 5 o'clock, so much is changing. But there's one person here who can tell you in a very personal way how COVID is impacting people's lives. Manisha from Yale School of Medicine has talked to hundreds of patients. She's been in the hospitals, mainly at Yale New Haven. Many are reaching out to her. And she's had a chance to reflect on those informal personal interactions, how people realize they maybe got infected, how they realize after the fact maybe they've infected others, and some stories that I think it's worth all of us reflecting on as we go through the final quarter of this pandemic. Manisha, thank you for joining us today.
Thank you so much, Governor Lamont, for inviting me and providing me with this opportunity to speak with the public. I'm Dr. Manisha Jutani. I do not represent my employer or the hospital where I work, but I am here today to talk to you as an infectious disease physician and to share some of the stories that I have heard from patients that I have helped care for and people that have reached out to me. So, Governor Lamont's leadership has helped us get this far in this pandemic, and we're going to need it for a while longer to really help us get through. But there are so many things that everyday people like you and me can do to really make a difference in terms of who we are really seeing in the hospital. So to share a few stories with you. The first is one I wanted to tell you about 6 young people. So in their 30s, as Governor Lamont mentioned, it's a tough time to meet people when you're young right now, but they decide to go out to dinner together. And you can imagine that all 6 of those people are coming from different households. And one of them lives with her 67-year-old mother. And so that 30-something-year-old who gets infected at that dinner party then goes home and infects her mother unknowingly. And that patient then becomes my patient in the hospital. The second example I wanted to give you is of a woman in her 70s. She lives with her son, who's also in his 30s. And that son is very careful because he knows he lives with his mother, who's in her 70s. However, he has a friend who's a neighbor. And that neighbor goes out, routinely, like young people like to do. But he also then goes over to his friend's house for dinner a couple times a week. And that woman in her 70s cooks him dinner a couple times a week. So he, unknowingly, probably mildly infected himself, went on to infect the 70-plus-year-old woman who, again, was a patient of mine. And the third example I want to share today is that of two women in their 70s. We know for many older people, they've been sheltering at home. But many older people also live alone. And these two women wanted to share each other's company. But they don't really know all of the activities of each other. Turns out they decide to go get takeout together. They drive in a car together without a mask. They get some food to take out. They go back to one of the women's homes and eat a meal together. After that, they both are infected with COVID-19. We don't know whom infected whom. And neither knows where they got infected from in the first place. Probably just their activities of daily living. One of them goes to the hospital and is discharged within 5 days, after 2 visits to the hospital, actually. The other one has been in the ICU for now almost 3 weeks, and I hope she recovers. So I share these stories with you because as an infectious disease doctor, what I know is that certainly mealtimes are a major high-risk event when transmission of this virus can occur. Certainly high risk in a restaurant because you could be around others as well who are infecting you, but still even in a household environment. And there are so many things even young people can do who unknowingly may go on and infect older people that they know and care for without really meaning it. We want to trust those that we know and that are dear to us. But unfortunately, this virus is equal opportunity, and we all have a chance to get infected. So thank you for that opportunity, and I'll open it up further to the governor.
Hey, thank you, Manisha. Manisha's sticking around, and you just remind me, I can't mandate common sense. People say, make this go away, set the rules, and as you just remind us, all the little things that make a big impact in terms of those informal social interactions. And Manisha's here as well as Josh and Paul. Let's take some questions. Max?
NBC Connecticut.
Good afternoon, everyone. Any indication on the likelihood of people in Connecticut willing to get vaccinated? Has there been any improvement at all, or do we have any numbers?
The numbers I've seen show some modest improvement. As people are feeling a little more confident, they hear a lot more. They see that Britain has approved it as well. They're starting the vaccinations. So I think you're going to see an increasing percentage of people not only willing to get vaccinated, but wanting to get vaccinated. But right now, the number is still probably in the 70s, and obviously the more people that get vaccinated, the better. I think that's going to change over time.
And you talked about the executive order regarding providers. Do providers have the capabilities to administer, given that the vaccine has to be at a certain temperature?
Yeah, they have ramped up for this. They've prepared for this. I almost brought up the Pfizer box today with the dry ice in it so you can see, give you a sense of how it's being delivered right now. And yes, that's exactly what the providers are trained to do.
And then just wondering how the response has been to Step Up Connecticut, and wondering if also Manisha Jutani could speak to that as well, just about the exhaustion level that maybe she's seeing.
Josh, do you have current numbers there on Step Up Connecticut?
Yeah, we've seen a 500% increase in hits on the websites that we use to collect volunteers and to try to direct new staff to our schools, to other volunteer opportunities, and to our Medical Reserve Corps. So it's been great outpouring of interest and support so far. Dr. Giussani, do you want to comment on the staffing dynamic that you indicated?
Absolutely. And what I would say here is that volunteers are very welcome. However, critical care physicians are trained over decades, and they are a very revered resource. If you have COVID-19 and you're critically ill, you want one of our pulmonary critical care doctors taking care of you. And with the influx of patients that we have had, we only have a limited resource of that. And that is part of the reason why so many of us physicians signed a letter asking for certain measures to be put in place, because particularly in our ICUs, we only have so much staff, nurses and physicians, who can really take care of patients to the best of our ability.
So just to be clear, Manisha Jutani, you are part of that group that is asking for restaurants and gyms to be closed?
So I was one of the letter writers, signer of the letter that was sent to the governor, and we appreciate the governor meeting with us after we signed that letter. I am in favor in terms of not recommending people going to restaurants. I think that there are many places that will need to be under consideration. I understand the governor has to weigh a number of different considerations, but I do have significant concerns. That's part of the reason I'm here today, to try to ask the American people to partner with us to be able to put a dent in the curve of this pandemic. And changes, I think, are going to have to happen.
Thank you so much.
Channel 3 Eyewitness News.
Yes, Governor, where we stand today with around 1,200 hospitalizations, is this where we want to be in this point in December, or is the virus outpacing our efforts to control it?
I think we knew that that period of time after Thanksgiving, we were going to probably see some increase in infections, and we saw the increase in infections. We see that reflected in hospitalizations. I was talking to Scott Gottlieb again today. He certainly predicted that infections and hospitalizations could go up over the next month or so. So we are watching that carefully. We say, is this where we want to be? No, of course it's not where we want to be. Is it totally unexpected? I think we're ready.
Got it. And a follow-up from last week. Do we know how many businesses have gone out of business during this pandemic?
We've seen the restaurant report that 600 have gone out of business in the restaurant industry. I'm afraid I haven't gotten the current number on terms of more broadly what's happening. Frankly, many of them are taking a pause, and many of them are closed now, hoping to reopen again as soon as we get on the backside of this pandemic.
And my final one, this is a little off topic. Foxwoods and DraftKings, they announced their partnership to bring sports wagering to Connecticut. Is there a timeline as to when that could be legalized in our state?
Well, I'll start and hand that over to Paul, but no, there's no timeline. They have a marketing agreement, which is fine, in anticipation of sometime we'll be able to allow sports betting and fantasy sports here in the state of Connecticut. I've seen that negotiated with around other parts of the country, and it's something we're working on very actively.
Yeah, as the governor stated, we were made aware of this agreement between DraftKings and Foxwoods, which will serve as a technology partner and a marketing agreement. Our administration will be continuing to have conversations with the two tribal nations as it deals with any particular expansion of gaming in the state of Connecticut, and we look forward to having those very thorough conversations continue as we approach the start of the legislative session.
Fox 61.
Hi, Governor. Zania Maldonado, Fox 61. Part one of my question is probably for Dr. Giussani, and then the second half for you, Governor. Peak of cases expected to be mid to late January. Does that prediction remain the same? If so, are there any vaccine-related plans to prepare for that peak, such as a rush to get as many of those healthcare workers as possible vaccinated?
From the projections I've seen, that peak does sound correct. And I think we're going to be deploying these vaccines as soon as they're available. We have no real idea of how vaccinating potentially nursing home residents and other older adults could impact that curve, because that potentially could be where admissions would be helped if we were able to reduce the number of admissions by vaccinating a high-risk population. Vaccinating healthcare workers is really to protect us frontline workers who are at the forefront of caring for those patients. So I do think that that peak is still anticipated to be mid-January, but there are public health interventions we can still do now to put a dent into that peak.
And then, Governor, was there anything you wanted to add about vaccine deployment?
No, I think Manisha said it right. The only thing I would add is I think you're going to see the supply of vaccines increasing over the course of the next few months. And, Scott said probably we're going to hit that apex sometime in late March, early April, where supply and demand sort of match. And then maybe thereafter we'll have more vaccine. We'll be working even harder to get more people. We have to work hard to get them vaccinated at that point.
And then does the state think there's any particular reason why Connecticut's two easternmost counties, Windham and New London counties, are the only two in the state that have surpassed their previous spring peak in COVID hospitalizations?
Boy, I'm trying to find rhyme or reason. I can make things up. I can tell you that Rhode Island has a very, very high infection rate. There are a lot of workers that go back and forth. But as I look around the country and try and find trends, go ahead, Josh, you take this.
Yeah, you're right, Governor. There are a lot of competing dynamics. I mean, I think the other one worth mentioning is that when you look back on the spring surge, it really came up from New York and started to work its way across the state. Closed down the state early under the governor's direction. And as a result, by the time the spread was working its way up towards eastern Connecticut, it had largely died out. And their peaks were actually very shallow back in the spring, if you recall. So there was a less severe comparison to be made there.
News 8. News 8. WTIC 1080 News.
Doctor, do you consider last spring across the country a missed opportunity to do some of the containment that we're still hoping to do now?
I actually think in the state of Connecticut, under the leadership of Governor Lamont, we really crushed the curve. We had a lot of unanticipated things. This was a new virus. We had no testing in the lost month of February. We had no idea how much it was actually percolating in our community. And because measures were put in place, the virus was already out there. And then it came down. The mask mandate in the state of Connecticut happened, I believe, on April 20th. And you really see things turn around after that in the state of Connecticut. So I do think we had an opportunity. I think the community is fatigued and the weather is working against us. When it is dark, cold, and not humid, this virus goes to town and is just having a party. It is equal opportunity, and it is going to infect people worst in the winter. So I think we had our opportunity, and we did the best we could, given the circumstances that we had no testing in the entire month of February. But now we just have to do it again. We just have to do it again because we have a lot of sick people in Connecticut. Our hospitals are full of patients that do not have COVID and now also have COVID. So I think our hospital system is under tremendous stress taking care of a sick Connecticut right now.
And Governor, on another topic, the Hartford Courant, the company out of Chicago, shutting down the building at the end of the month, and the Courant Guild wants to help force a sale. Have you heard anything about anyone locally who might buy that very important newspaper?
I have not heard that, but it's the oldest continuing continuously published newspaper in the country, and we got to do everything we can to make sure somebody who really appreciates what it means to our community and our state and our country.
News 12 Connecticut.
Hi, Governor. I don't know if you or Josh or Paul want to expand on this, but can you give us more details about the upcoming executive order, exactly who is going to be allowed to administer the vaccine under it and where they'll be allowed to do it?
Go ahead, Josh.
Sure. So it will specifically allow pharmacies to administer COVID-19 vaccine, which is an important step to enable our partners, and particularly in the early phase 1A here, CVS and Walgreens, who are under contract with the federal government through Project Warp Speed, to begin deployment of the COVID vaccine to our nursing homes, as the governor mentioned, starting 2 weeks from today. So that's an important step, but as the governor also mentioned, it helps expand the opportunity to other providers for phase 1B and beyond, where we will need many more partners beyond just those two pharmacy chains, as well as our hospitals who are in the process of mobilizing vaccination resources as part of phase 1A. As we get to phase 2, we're talking about well over 1 million people, phase 1B, we're talking about well over 1 million people in scope for that phase, and many more vaccines coming into the state. So it'll give us the opportunity to enroll many more providers to participate in this important program.
And are we talking just pharmacists that would be able to do it, or other folks too?
That's what's covered in this executive order. And with that, as well as with our other licensed healthcare professionals who are already authorized, it gives us a very broad reach. And if we need to continue to open it up further, we certainly can.
And Governor, I just want to follow up on Matthew Campbell's question real quick about the Foxwoods deal. Last year, you endorsed legislation that would have opened this up beyond the, beyond the tribes. Are you prepared to do that again in 2021, or are you concerned about a lawsuit and hoping to avoid that?
Well, obviously, I'd like to avoid a lawsuit. That doesn't help anybody, but I also want to get this thing moving. As you can tell by FanDuel and some of these other marketing arrangements, this is something that's going on all around us, and I think Connecticut should participate. If we've found out anything in the course of this horrible COVID cycle, is that more and more the world is going virtual. More and more the world is going online. And that's telehealth and telelearning, but it's also iGaming and sports betting. And I don't think you want Connecticut left behind.
So if the tribes threaten to sue if you open this up, are you saying that state lawmakers should take that risk and go ahead and pass this and open it up?
No. Paul and I are good discussions with the different players, making sure we can reach an agreement that meets their needs as well as avoids the threat of lawsuits. We're going to get there.
Yeah. I mean, the reason I asked is because I was talking to Rodney Butler today, and he said, look, if they open this up to anyone other than us, we will sue.
Well, I'll step in, Governor, that there's two parties as it deals with the compact, the state of Connecticut and the two tribal partners. We're going to all get in a room. We're all going to have conversations. We're all going to come to an agreement. We'll all come to the legislature, and hopefully something that's jointly agreed upon will be passed. That's the only way that we're all going to move forward. We've been down this game and been down this road for many years, in previous administrations and now this administration. In order for this to get done, all parties have to come to an agreement. And the key for the governor is focused on is what's best for the state of Connecticut and what's best moving forward. But we look forward to having very thorough conversations with them. And I know where the governor stands. The governor knows where he stands, and we'll be having those conversations at the table with them. And we'll keep you up to date.
The Associated Press.
Thank you. Good afternoon, everyone. Governor, is there a goal in terms of the percentage of Connecticut residents that should be vaccinated ultimately?
Oh, yeah. I mean, you certainly want to have, 95% of your people vaccinated. That's safe for them. It's safer for the broader community, allows our economy to get back going again, make sure that kids and teachers and everybody, we can get back to our normal life. So that's our goal, and I think we're going to get there.
Are there plans to have some sort of a big public service campaign in Connecticut to encourage people? And I've heard some people voice concern that the vaccine may be mandatory, and I just wanted you to clarify whether or not it would be or not.
Yeah, we haven't thought about that, but we certainly thought about a public relations campaign and getting leaders willing to get vaccinated, show that publicly. You know, we got Deirdre and Reg on the vaccination advisory group. We got folks from all the different communities in our state, so they're able to go back to their community and say why it's so important for you in our community that you get vaccinated. We're going to get there.
And I had a question for the doctor. We often hear from the Connecticut Restaurant Association that their members have taken extraordinary steps to be safe, and they say there haven't been any outbreaks tied to restaurants. Do you believe this is the case?
Restaurants have done the best they can given the nature of restaurant dining. I miss restaurant dining. I wish I would feel comfortable to go back. My reason for discomfort is not because of their lack of preparation. The issue is if you're a family of 4 and you go to a restaurant and there's hardly anybody else there and you eat just among your household, the risk is probably very low. However, in the first example that I gave you of 6 different people from 6 different households coming together with their masks down for the entire time that they're sitting at a table together, the risk of transmission is extremely high. And then those people can potentially bring it back to other household members. And this is where the risks in restaurants can be tremendous. However, if those same 6 people go and eat at home together and do takeout, that risk is equally high. So I do have concerns about restaurants, but I also am asking the people of Connecticut not to do that kind of behavior, because that is where this virus is going to continue to be transmitted. And getting together with friends is commonplace to happen in restaurants. This is why restaurant dining is potentially problematic.
Thank you very much.
The Day of New London.
Thanks. The first question is for the governor. A coalition of Democratic state lawmakers from Eastern Connecticut today announced they plan to propose legislation that would create a pandemic preparedness office in the state. That office would focus on testing, emergency stockpiles of equipment, and things like that. Is that something you would support, or do you think that's something that's needed?
Oh, they should come and talk to me about it. I think we've got a pandemic preparedness group right now. Early on, it was the reopening committee. Now it's the vaccination advisory group. We've got a great team in-house that's working with a group of advisors. But if there's some things we should be doing that we're not, I look forward to talking to the legislators.
Thanks. And then the second question is for Dr. Giussani. Curious about the 2 vaccines from Moderna and Pfizer. I believe both of them 2 doses are needed. Could you explain why that is and how the COVID-19 vaccine differs from the flu vaccine?
So first of all, both vaccines were developed slightly differently. And so the way they were tested, one is 3 weeks apart, one is 4 weeks apart. To really develop the optimal immunity to the virus, you need both shots. So this is the reason, this is the way it's been tested, and their earlier studies suggested that this was the best way to move forward with vaccinating people. In terms of the flu shot, it's different because the flu shot uses a different mechanism. And these 2 Pfizer and Moderna vaccines are using basically a small mRNA that is injected and then allows your body to elicit a response as if it can develop immunity to that actual virus. The coronavirus is known as that because it is thought to have all these different spikes, or corona, like a crown. And so this antibodies would be to those actual pieces of the crown. That's how you would build your immunity. Flu shot is usually through the actual flu virus that is inactivated. It's less severe. And this is why people sometimes feel like maybe they get a little bit of the flu, which it's not really the flu, but they're getting those flu-like symptoms when they get the shot. So it's a different mechanism of action. But I want people to know that although these are new vaccines, it is decades and decades of research on mRNA vaccines that scientists have been doing, which is why I fully support these vaccines. I will be in line and sign up as soon as I'm given the opportunity to do so. And I'm looking at creating patriotic V pins that people can wear to to show that they've been vaccinated. This is a patriotic move that we can do to help protect fellow Americans and ourselves.
The Hartford Current.
Hi, Governor. First of all, thank you for acknowledging the Current earlier. We appreciate that. I wanted to ask you about Governor Cuomo's comments today that he said it's probable that indoor dining will be shut down in New York City and maybe restricted elsewhere in the state. I know it's been important to you to act on a regional basis in conjunction with these other states. So how does that announcement affect your thinking here?
No decisions have been made, but I am talking to all my fellow governors, and we're going to do the right thing together.
So if you're planning to act together, does that mean we can more or less expect that you'll follow what New York does?
Well, I'm talking to Gina and Charlie later this afternoon, not about this per se, but just other things we can do depending on where the metrics go over the course of the next couple of weeks.
So I know you've been asked pretty frequently about whether you have a specific threshold at which you would make certain decisions, and you have basically said you don't. I just want to clarify, is it that you don't have any sort of statistical thresholds in mind, or that you don't feel comfortable sharing what they are?
No, I've said many times that I think capacity of our hospitals, capacity of our ICUs, and the capacity of our nurses and docs to take care of people is the number one criterion, I would think, as we think about what next steps we have. Next steps can be a variety of things. It can be reducing places where people can get infected. Manisha was talking about some possibilities there. Also elective surgeries or the non-urgent elective surgeries, other ways that you can increase some capacity. Something else that Governor Cuomo, Governor Newsom, and others, I think actually Charlie Baker up in Massachusetts put in place restrictions that go into effect at the end of this week. So these are all tools in our toolbox that we have that we can allow us to better deal with the pandemic if it continues to expand.
Right, but so you're looking at hospital capacity and ICU capacity, but I'm just trying to understand whether there is internally, even if you're not comfortable sharing it, some sort of threshold at which, all right, we've hit 90% ICU capacity, we've hit 80% ICU capacity, whatever it is, that would trigger any sort of decision.
It's not absolute, but, Gavin Newsom said 85%. So that's a number. Depends whether it's going like that or it's going like that. But I think that gives you some indication.
Okay, thank you.
Hearst, Connecticut Media.
Thanks, Max. Governor, you're dodging that question pretty nicely. Maybe we could put it in terms of ice skating. How thin is the ice that we're dancing on in Connecticut?
I think you've seen the numbers. I think I pointed out the hospitalizations have actually, the net hospitalizations have taken a little bit of a dip over the last week. I draw no comfort from that because I know how fast things can go back and forth. We're following it really closely, Ken, and I think we're going to have to wait a little bit longer. But as I told you, we got a couple of things we can do to mitigate, including electives. So not everything results in closing things down.
Thanks. Dr. Juthani, what's your opinion on the willingness of people to respond to contact tracing? Are you able to have an opinion about that? Certainly when you've got somebody in bed in front of you in the hospital, it's hard for them to not answer.
I've found that in my community, people are very eager to actually be open to contact tracing. I think the vast majority of people are mask-wearing people in Connecticut and want to do the right thing, don't want to hurt anybody else, don't want this virus to spread. And so I feel that the majority of people have participated in contact tracing. Having said that, there are going to be people that might not answer the phone, might be more challenging to track down. But I overall feel that people have understood the importance of this and have adhered to what they need to do to try to spread further COVID-19 cases.
Thanks. And Governor and possibly Josh, if we've got 18,000 people in nursing homes and we've got 16,000 doses coming in that first week, what happens? And is there a dichotomy going on between Dr. Gottlieb suggesting that that first round, all 16,000 go to 16,000 different people, as opposed to, I thought there was some federal guideline about cutting it in half and keeping the second dose for the second round?
No, he's talked about let's get those doses out as quickly as we can, dispersed as quickly as we can to people. We talked about it just today, as a matter of fact. Some people draw a false dichotomy between lives and livelihoods, folks on the front lines, folks who are older in nursing homes. But in fact, when you provide vaccinations for people in nursing homes, A, you're keeping people alive, and B, you are freeing up capacity in our ICUs and hospitals. So that's another thing, Ken, that may change a little bit as we watch the dynamics over the next few weeks.
Yeah, and Ken, to your point about the 16,000 going into nursing homes and the numbers there, as the governor laid out last Thursday, that's just the week one order. And so we'll be ordering on a weekly basis. And our estimates are that by early to mid-January, there will have been enough vaccine distributed through our nursing homes and our long-term care to get that first dose to all residents and staff in those facilities. And by staff, we're not just talking about the nurses, it's all staff in the building. So it's custodial staff, it's food service staff, it's everybody in there. There'll be enough to go around for everyone for that first dose by, we think, the first or second week of January at this point.
Thank you.
The Connecticut Mirror.
Doctor, if you had the authority, what kind of orders would you put in place right now as far as restrictions? You did say earlier that changes are going to happen. So what would you order if you had the authority, and what changes must happen?
I feel that indoor dining is very risky. I don't think that it's necessary to continue at this point. And I would suggest that we all do takeout and tip people who are providing service for us to be able to help our restaurant workers. I think there are other places, though, that I see also I consider to be high risk. I am concerned about what happens in casinos. I'm concerned about things like, tanning salons. There are a variety of different places. So from my perspective, I don't have the full scope of everything that the governor would have at his disposal. But what I can tell you is that indoor dining is at least an obvious place where people have their masks down and are in close proximity to each other for a long period of time. And I do not say that without understanding the implication of that. And I also don't say that saying that this would be forever. I think the month of December is a very high risk month. And we have holidays coming up, and then January is going to be another heavy month for infections because it's going to be the price we pay for December. And by February, I'm hoping the weather starts cooperating with us a little bit more and we have some of our population vaccinated. That is what I'm hopeful on. But how the vaccine is going to play into that, I just don't know yet.
Governor Cuomo today talked about looking out 3 weeks, and if he sees a certain level of hospitalizations out in 3 weeks, he then would, impose further restrictions. Is there any model that you've seen that makes you confident enough to decide, okay, we can wait because we're going to know what things look like in 3 weeks?
I'll start with that, Paz. Look, I'm not an expert on what things are going to look like in 3 weeks, but I can tell you what's happening today. For example, we spent a lot of time talking about our restaurants. Their reservations were down 18% in October, 43% in November, down a lot more than that over the course of the last week. So, as Manisha said, the real risk is indoor dining. And for everything you do, every action, there is a reaction. So I've got to figure out, for those few people maybe who are still doing indoor dining, do I shut that down? If I shut that down, where do they go? Maybe they can't go to Andrew Cuomo's state, but they can go to Charlie Baker's state. Or they go to one of those indoor parties that Manisha was talking about. So these are all the things that we are trying to take into balance as we think about what we can do. And as I've said many times, if I can do this in regional coordination, it makes it a lot more effective.
And Governor, on the question of the DraftKings and the casinos, I want to be clear. Are you going to put forward legislation this year that will reflect your view of what should happen with an expansion of legalized gambling?
The answer to that is, look, I'm in active discussions with you-know-who, and based upon the feedback I get there, we're going to put in place some legislation that allows this state to move forward when it comes to online gaming and sports betting.
All right, let me try that again. That sounds like you're saying you're only going to put forward legislation if you have a deal with the tribes. Is that what you're saying?
Yeah, I want to put forward something that's going to work, that doesn't result in litigation, that gets us off the dime. We've been talking about this for close to a decade in this state. And frankly, the whole world is moving virtual, and that includes the gaming industry. And I think Connecticut ought to participate and ought to be led by the tribes.
Well, I mean, if you do online gaming for casino games, I think there is a consensus that the tribes have exclusivity since they have exclusive rights to casino games. But there is a difference about whether you could share sports betting. So would the tribes basically have veto on any legislation going forward, as opposed to you putting forward a bill that could say the tribes would have rights to casino online gaming and there would be some kind of sharing with sports betting?
I'll get back to you on that.
All right. And Josh, what's the 7-day rolling average at this point?
6.5%.
6.5. Thank you all.
CT News Junkie.
Thanks, Max. Governor, young people have overtaken older people in the amount of infection. Is there anything we can do to change the messaging to reach out to them to maybe slow that trend down?
Yes, get Manisha on our afternoon briefings more often. I think she told the story brilliantly about how it's those informal social interactions. We're not necessarily being lax, but we're just not paying as much attention. It's that person my age, as you described it, who's maybe making dinner and serving folks, who all of a sudden inadvertently gets infected, and that's how you get a flare-up. And I think we've got to tell that story everywhere we can go. I can do so much by mandate, but the other 90% is how you handle yourselves and your families and your community.
Dr. Justine, anything you want to add to that?
What I'd like to say about that is that I think a lot of young people, and quite honestly, a lot of people have gotten tired of this virus, and they think they know a lot of people that haven't gotten that sick. But the reality is we have people that have been long haulers that have symptoms that last many, many months. Having no sense of taste or smell is not pleasant. And let me tell you, what really hits home for the many families I've seen is when your mother, grandmother, grandfather is affected by this illness. That is the last thing as a young person you want to have on your conscience. And at the end of the day, if we can remember that it is patriotic at this point to follow these public health measures and to have our guard up at all times. And we have to use reason. We have to work with our young people. I am the mother of a 17-year-old and a 20-year-old. I know what it's like. I understand it's difficult. I understand how difficult it is to be a young person in this environment. And we have to work with people. Abstinence is not the solution. As an infectious disease doctor, I know that. And I know that we need to work with people, but follow public health measures while we do that. There are ways that you can do things fun that are still safe. Why are our schools so safe? Is because they are doing everything we've asked them to do. And that's the reason why our children have been doing relatively well in school systems.
Thank you. Governor, I'd like to ask quickly about pedestrian deaths. I know this obviously pales in comparison to COVID, but there's been 52 that we know of deaths of pedestrians and 6 cyclists this year. One high-profile one recently in Vernon. Is there anything we could do as a state to sort of cut down on this trend?
I think we're seeing, again, evidence of extreme stress related to COVID. We saw it in the spring where there was so much less driving, but people who were driving like a bat out of hell. They were going fast. And we had, some really severe accidents related there. So I think what we've got to do, I'm not sure if I could do it all by policing, if that's what you're implying. I think what we can do is take a look at where these incidents are and do everything I can to convince people how important it is you be careful, no matter how frustrated you may be right now with this pandemic.
I think I meant as far as would you put forward any legislation to change anything like that?
Let me get back to you. I'm not sure what I could do by legislation, but I'll think about it.
All right. Thanks, everybody.
Connecticut Public Media.
Good afternoon. This question's for Dr. Juthani. You spoke a lot about restaurants being a place where it could be contracted, but are there any other areas where you think the public should be aware that they're more at risk of spreading COVID?
Anywhere where you cannot keep your distance and you keep your mask off for a prolonged period of time. The number one thing that I think people can really benefit from is keeping distance. And masks as well. Obviously, both are really important. But the further away you are from somebody, the more likely you are to be protected. So if you're getting a massage and you're really up close and personal with somebody, even if you're both wearing masks, it potentially could be a risk. I do not like the life we all have to live right now. I think this is not what we all would prefer. However, I count my blessings for having my health, and I would suggest to people, think about what your activities of daily living are. What do you need to do, and what might you not need to do? We need to go grocery shopping. Now, maybe you're somebody that can get delivery. Great. If you can do that, and that is something that's convenient for you, that's a place you don't need to go. Can you go at a time which is less busy? And so potentially you aren't in close contact with other people. I think our grocery stores have done an amazing job of trying to keep numbers down, keep distance between people. So I think it's been relatively safe in our communities. But I think people really just have to think about where do they go and what do they do. We know the outside is better than the inside, but it is colder now. So it is more difficult. I hope that answers your question.
Thank you.
The Waterbury Republican American.
Thanks very much. Got a question to clarify the governor's answer to Sue Haig. Governor, back in July when we were at Pfizer, you were asked if we were going to make COVID vaccination mandatory. You said we haven't made things mandatory yet because people have generally stepped up and done the right thing when we asked them to, like masks, for example. Then on November 9th, you were asked if you were going to order mass vaccinations in Connecticut. Your answer was no, that is not the way I'm thinking about it. Today, you said you guys hadn't given thought to it. Can you please explain what's going on? Are you contemplating requiring mass vaccinations?
No, we're not thinking about that. I don't think we need to do it. I think, as you pointed out, Paul, when it came to wearing the mask, people in Connecticut, more than just about any state in the country, have done the right thing without making it a mandate. And I think you're going to find we're more likely to take the flu vaccine than just about any state in the country. And I think you're going to find people in Connecticut are smart and overwhelmingly will get the vaccine voluntarily.
Governor, I had a retired nurse and reader call me on Friday, very upset that you are not following the advice of Dr. Juthani and others who signed that letter asking that certain steps be taken, certain closures be ordered. She just can't understand why you're not listening to the medical professionals when you keep saying science is going to guide your decision making. So you could explain to that reader, I know you spoke a little bit about this earlier, but could you explain to that reader what your thinking is?
My thinking is, as you heard, look, all those places where you tend to be in close quarters, indoor, where you can't wear a mask, for example, eating, is relatively high risk, especially if you're not with just your immediate cohort, your immediate family. But as I also said, for every action, there's a reaction. So if you just shut down all the restaurants, which perhaps is what one of the implications is, what happens there? Do people go out of state? Do they go have a party at a friend's house? These are all the things we have to balance when it comes to what's the right mix to keep you safe.
Doctor, what do you think of that reply?
I think we're going to need to have changes made in the time to come. The governor's heard what I think. I do agree with him that if restaurants shut down, but people continue that behavior in households, that's not going to work. You know, in the first wave, the people of Connecticut were scared of the virus and were on board and really worked with us as a medical community. So what I'm asking of the people of Connecticut is that this time around, if restaurants get shut down, please stick with that and don't gather for meals indoors with people that are not part of your household. So I don't want to see that we actually hurt restaurants, but then are still having the same consequences. I do believe that the people of Connecticut are hearing us and they know what we are going through. And the percent of reservations going down month over month in the state of Connecticut in restaurants is evidence of that. So I do think restaurants need to shut down, but I also want to see that people have bought into why we're asking the restaurants to do that. And this is not forever. This is for hopefully a short period of time as vaccines can roll out and we can just get through this winter.
Thank you. And I got another reader question. I guess it could be for you, Governor, or I don't know if Josh might have some thoughts on this. This particular reader was upset that prison inmates would be receiving vaccines before, as he described it, law-abiding citizens. So could you guys perhaps explain the rationale for vaccinating this vulnerable population?
Sure. So as Dr. Gifford and Dr. E discussed last Thursday, there's still a lot of work to do to further segment that phase 2B population, which includes well over 1 million people. And so we'll be working through that. But what's important for everyone to understand is when you're talking about our incarcerated population, these are people who are the responsibility of the state, and they're also living in congregate settings where they're often living in close quarters, where we know whether it's a congregate facility like a nursing home or an assisted living facility or a prison or a group home or a homeless shelter, very high risk of rapid transmission of the virus. And our goal is to prevent as much infection and illness and death as we possibly can. And so we need to work with our public health professionals under guidance from our federal partners to prioritize the vaccine in a way that provides the greatest benefits.
I think I've got the signal that that's it. And thank you for bearing with us. We've gone a little bit longer. Manisha, thank you so much for your telling words and how important, what a difference people can make in terms of just their basic behavior and respect, Connecticut respect for themselves, more importantly, respect for those around them. I wanted to say something else, though. Today is Pearl Harbor Remembrance Day, and I was just reading in Twitter, which I've got more accustomed to doing, that Connecticut lost its last surviving person who was there at Pearl Harbor, and his name, Floyd Welch from East Lyme. He died this summer at the age of 99, a little bit of living history. And if you study history, people didn't take World War II as seriously as they should have before Pearl Harbor. They thought it was wars over there and weren't going to impact us. And Charles Lindbergh and the first America Firsters were saying, don't worry about it. And then Pearl Harbor hit. and we knew that we were in a war and that we could not avoid it. And with COVID, it just seems we haven't had that necessarily that Pearl Harbor moment. The enemy's more invisible. But I think every day more and more people are realizing that you can't deny it. It's here and it's real. And as Manisha says, we can fight it every day by doing the right thing for our community, our family, and our neighborhood. And that's how we're going to fight this thing back. We've got a little bit longer to go, but help us on the way. We've got to stick together. Thank you, everybody.